Please, Dr. Lincoln, could please stay on the stage because we are going to have a discussion right now on the stage. Let me please help some supporters to move the chair so that we can start our discussion session. It's okay because you have already made your way up here. That is really, really appreciated. So right now, I would like to invite on the stage we will now move on to the panel discussion 1, moderated by Professor Lan Ken Lee. This discussion will bring together our speakers to further explore the opportunities, challenges, and clinical applications of non-invasive treatments. We kindly invite all the speakers to return to the stage for the panel session. Now, Professor Lan, I would like to give this micro to you so that you can start hosting this.
Okay, thank you. It's my honor to host this panel discussion. Is there any question from the audience? Is there any question for the 4 speakers? Let me make a 1-minute comment about our presentation today. I think there's promising progress in the immunotherapy, and they will target the residual resistant tumor cell with our own immune cells. And so, from my point of view, carbon ion therapy can eliminate the majority of the cancers, maybe 90% or 99.99%. But there will be some residual tumor cell either escape the destruction of carbon ion therapy, or they already metastasize to other critical organ. And then there will be a role for immune system to get rid of all the tumor cells. I think cure cancer is not a dream, as long as you can coordinate all the available tools so I like your slogan, cure the incurable, help the helpless.
Yeah.
And any question from the audience, or maybe we start?
Yeah, in this moment, we're also going to try to the research for the immune cell therapy with the radiotherapy going to the help, going combine together, going to the treat the cancer patient.
Yeah, I'm a hematologist, so fortunately, the cell therapy, immune therapy is our initiated in our top field. So the allogeneic transplantation is a traditional oldest immune therapy, cellular therapy. So right now, we try to improve our genetic the outcome, the methodology of allogeneic transplantation. Right now, we have CAR T therapy. Of course, the CAR T, if we can improve to be universal allogeneic CAR T, is very that's a good option, but always need to overcome the GVHT. Right now, we have many immune T cell engaging therapy. So for being a hematologist, I always told my student, die hard. Die hard is we always try to do our everything to cure, to care our patient. Yeah.
And thanks for the. I think in Taipei Veteran General Hospital, it is very glad to have many weapons to fight the cancer. We have the radiotherapy, the carbon ion, and the immunotherapy, the target therapy, and chemotherapy, and the most important one is the surgery. So even the stage 4 metastatic disease, we can use different weapons on different settings and to control the disease and even make the patient survive longer and even cure. So I think the incorporation of the cell therapy, we can let the patient feel more better and have more healthier immune system, and can receive furthermore the chemotherapy and the radiotherapy. So I think other than the immunotherapy, the chemotherapy, radiotherapy, surgery therapy are also important.
Yeah. Thank you for your excellent presentation. I have two questions. First question for Professor Lan is you have carbon ion therapy and also BCNU as in the talk with this morning. So you have your own kind of radiotherapy machine in your department. So how can you stratify your patients or your to different kind of radiotherapy? And the second question is, we are on a session of non-invasive treatment. Do you think in the future, this will be the trend for the treatment of cancer disease because they combine between the radiotherapy and the cell therapy? Thank you.
So we are very fortunate to have two advanced cutting-edge radiotherapy in our hospital. And so it depends on, there's still some small difference will trigger different type of decision. For example, diffuse pontine glioma. This is the cancer cell mixed in the brainstem. So you really need to differentiate the killing, one by one, different cells. So that would be a good indication for BNCT, bone neutron capture therapy. But for example, pancreatic cancer, the normal cell mix, actually although they mix with the cancer cell, but those normal cells, sometimes they are fibroblast or endothelial cell or macrophage. They're all supporting tumor cell. So we don't care about the normal cell within the tumor. We just try to eradicate all of them. But for those normal cell mixed with a critical normal cell mixed with the tumor cell, or sometimes the recurrent head and neck cancer, we are afraid of a very severe side effect because those patients, they might already underwent 1 time or 2 times photon radiotherapy. There's no room for further damage. So BNCD would be a good choice. So it really depends on different indication. Yeah.
Right. Yes, thank you for your own very beautiful presentation. I have 2 questions. The first question, I want to understand about for the solid tumor cancer. So what kind of disease, what kind of cell, NK or T cell that can be used in clinical in Taiwan legally? And the second, for the bone marrow transplantation, I understand know that the CAR-T is also available in Taiwan, but I want to understand more the cell processing of CAR-T is processing in Taiwan, or you combine with another company for processing it outside the country. Thank you.
And so I answered the first question, and maybe the second question is more suitable for the Professor Xiao to answer because he is the specialty in hematology malignancy. So for the first question, in Taiwan we have the NK cell therapy, autologous NK cell therapy for solid tumors, and especially for the stage 4 solid tumors. We do not have the allogenic NK cell or allergic T cell or gamma delta T or other cells. We only have the NK cells available, especially in Taipei Veteran General Hospital. We have NK cell autologous therapy. So one of my pancreatic cancer patients, she received the chemotherapy for stage 4 pancreatic cancer. And also she received the NK cell therapy between, because the chemotherapy is the 2-week cycle. So between every chemotherapy infusion, she received the cell therapy and she got a better after the cell therapy.
Yeah. For the second question is the CAR T availability. Yeah, in Taiwan we have right now is the only one label is Novartis T-cell cell. Yeah, we follow the label is and also we has a health insurance 2 years ago in November 2022. Yeah, in Taiwan right now we have 8 hospital which is certified by the Novartis, so we can apply the case. In addition, we know in Taiwan we have we have a several clinical trial for the CAR T cell, the CAR T produced in Taiwan. We know the CAR T in like Novartis CAR T, we needed to send the T cell to the fly to the Swiss in Taiwan. So we needed to spend 1 month to get the sample. And right now we in Taiwan have several company to initiate the clinical trial. And finally, in fact, in our hospital, we also can produce the so-called academic CAR T, but for these 2 ways, is the academic CAR T is the other is a company in Taiwan. Right now we have a government regulation. Right now, the still struggle. You know, for a company in Taiwan, if you want to perform the phase 3 trial, it's difficult. So maybe the government maybe approve if the case if we finish the phase 2 trial, early access. For academic the CAR T, that's another difficulty. Yeah, but we still have some able to improve. Yeah.
Actually, we are under the preclinical research in the not only the CAR T, we also going to the CAR NK, NK different treatment going to the different the cancer patient. So this is we are also all the new technology will be going under preclinical side research, and I think that we are under the evaluation or the treatment. I think that they will very near future will be going to get good for the cancer patient.
Okay, so any more questions from the audience? I think we schedule is to right now, right? Okay, so thank you very much for your participation. Thanks.
Thank you, our guest speaker, you can drop your microphone there. Yeah. Ladies and gentlemen, that is also the concludes of session 1, the non-invasive treatment. Now, on behalf of the organizing committee, we sincerely thank you for the esteemed speakers for their valuable insights, and we thank you all for your kind attention. Now, we invite you to join us for lunch, which will begin at 12:30 and continue until 1:30. So please return to the main hall after lunch to continue with the session 2, part 2 of our conference program. Thank you.